Hey, welcome. So, tucked away at the very back of your eye, there's this incredibly delicate layer of nerve tissue called the retina. You can think of it as the living film where your vision actually begins. In this explainer, we're going to dive into what happens when that crucial tissue starts to have problems.
All right, so here's our roadmap. First, we'll get a handle on what the retina really is. Then, we'll look at what happens when its blood supply gets clogged up, when its cells start to fail, and, the really serious stuff, when the whole structure literally comes apart. And we'll wrap up by looking at how modern medicine is fighting back.
This incredibly complex tissue is responsible for processing every single thing you see. So what happens when this living film gets damaged?
Okay, so the textbook definition calls it the nervous coat of the eyeball. But what does that really mean? Well, it's basically a layer of nerve cells that lines the inside of your eye at the back. Its whole job is to catch light and then translate it into electrical signals that shoot down the optic nerve to your brain. It's the biological hardware that turns light into actual sight.
The best analogy is probably the film in an old-school camera. Light comes in through the lens at the front, right? And it gets focused onto the retina at the back. The retina captures that image, and then your brain kind of develops it. So it makes sense. If your film is damaged, you're just not going to get a clear picture, no matter how good the lens is.
The retina is living tissue, which means it needs a constant, fresh supply of blood to survive. The tiny little arteries and veins that crisscross it are like its essential plumbing system. And, just like in your house, when that plumbing gets blocked, you've got a really serious problem on your hands.
Okay, this is really interesting. Let's break down the two main kinds of blockages. On one side, you have a retinal artery occlusion. That's the inflow pipe getting blocked. Blood can't get in, which means the retina is starved for oxygen, and boom, sudden, really bad vision loss. Doctors often see this classic cherry red spot as a telltale sign. But on the other side, you've got a vein occlusion. That's the outflow pipe. Blood gets in just fine, but it can't get out. So pressure builds up, causing bleeding all over the retina and a slower but still very serious loss of vision.
So, these blockages can happen on their own. But what happens when a disease that affects your whole body, a systemic disease, starts messing with these tiny, delicate blood vessels? Well, that brings us to diabetic retinopathy. It's one of the leading causes of blindness out there and a huge complication for people living with diabetes.
What happens is that chronically high blood sugar just wreaks havoc on the lining of these little vessels. It makes them weak, leaky, and sometimes they just close off completely. And yeah, all these things on the slide increase the risk, but the single biggest factor is just time. Put simply, the longer you've had diabetes, the higher your risk. And just how high are we talking? Well, check this out. After 20 years with type 1 diabetes, a staggering 90% of people will have developed some form of diabetic retinopathy. 90%. It just shows you how absolutely critical regular eye screenings are for anyone with diabetes.
But it's not always the blood supply. Sometimes the problem is with the retina's delicate wiring, the actual light-sensing cells themselves. They can just start to break down. This might happen because of age, like in macular degeneration, or because of instructions written right into your genetic code. A perfect example of this is a condition called Retinitis pigmentosa, or RP for short. And it's not actually one disease, it's a whole group of inherited conditions that all do the same thing. They cause the progressive death of the photoreceptor cells. We're talking about the rods and the cones, the very cells that detect light and color in the first place.
So what does this actually feel like for a patient? Well, because RP usually hits the rod cells first, and those are the ones for night vision, one of the very first signs is having a really hard time seeing in dim light. Then, as it gets worse, people start to lose their peripheral vision, which they often describe as getting tunnel vision, as those cells on the outer edges of the retina die off.
Now, in some other hereditary conditions, especially ones that affect the macula, that's the center of your retina, doctors can see some very specific things. This quote describes a really memorable one, a bullseye pattern of pigment loss. For an eye doctor, seeing that is a huge diagnostic clue for certain conditions that attack our central color-sensing cone cells.
So we've talked about problems with blood flow and problems with the cells themselves, but what if the retina physically pulls away from the back wall of the eye? It's literally like the screen in that camera we talked about just coming loose. And let me tell you, this is an absolute emergency.
This brings us to a really common question. I mean, a lot of people see occasional floaters, right? Those little squiggly lines that drift around your vision. But when are they a sign of something much, much more serious, like the retina actually tearing?
Okay, so here's the crucial difference. Having a few floaters you've had for a while is usually normal. The big warning sign is a sudden shower of new ones, especially if it comes with flashes of light. Those flashes, that's the retina being physically pulled on. The floaters are often tiny specks of blood from a torn vessel, and if a detachment starts, people often describe it as a shadow or a dark curtain falling over their vision.
And let's be crystal clear about this. This is not a wait and see what happens kind of situation. A retinal detachment is a true medical emergency. The longer the retina is separated from its blood supply at the back of the eye, the more its cells die, and that leads to permanent, irreversible vision loss. You have to get medical help immediately.
Okay, we've covered some pretty serious problems, so let's shift gears and talk about the solutions. For our last section, we're going to look at some of the modern treatments that have totally revolutionized how doctors can treat these diseases and, save people's sight.
This table gives us a great snapshot of the main tools in the toolbox. First up, you've got laser photocoagulation. It uses a focused laser to make tiny therapeutic burns to seal up leaky blood vessels or lower the retina's need for oxygen. Then you have anti-VEGF injections, which are a total game changer. They block a protein that makes bad leaky blood vessels grow. And finally, there's a vitrectomy, which is a surgical procedure where they actually go inside the eye to repair a detachment or clean out blood.
Let's zoom in on one of those laser treatments for a second. It's called pan-retinal photocoagulation, or PRP, and it's a real workhorse for advanced diabetic retinopathy. After some numbing drops, a special lens goes on the eye to help focus the laser. And then, the surgeon carefully applies somewhere between 1,500 and 3,000 tiny laser burns to the outer peripheral retina. The idea here is actually kind of sacrificial. By treating the less critical peripheral retina, you save the precious blood supply for the all-important central vision.
And really, this all boils down to the most important takeaway of all. Every single one of these incredible treatments works best when the disease is caught early. The problem is, a lot of these conditions, like diabetic retinopathy, have zero symptoms at the beginning. That is why getting a regular dilated eye exam is the single best thing you can do to protect your vision. I mean, we've come so far in treating diseases that used to be a one-way ticket to blindness. It really leaves you with this final, kind of hopeful question, right? With all the research happening in areas like gene therapy and stem cells, are we getting close to a time when we can not just treat these diseases, but actually reverse the damage and restore sight? It's a future that feels like it's getting closer every single day.